A patient walks into your OPD, he looks tired, a little breathlessness, or maybe some swelling in his legs. You don't have diagnosis yet, but in your hand there is a one report called RFT, that is renal function test. This is the one test can tell you if the kidneys are silently failing in the body, is drowning a toxins, or just a dehydration that you can fix in hours. So today we are not just learning a test, we are learning how to read a patient internal story. Many students feel nervous when they see the lab values, but remember this, patients don't expect you to know everything. They expect you to think logically and act calmly. RFT is the actual one of the simplest and most logical tests in the medicine. If you understand just 3 to 4 core ideas, you can confidently face case viva, case taking viva, and then ward rounds. So let's break it down like clinicians, not just exam students. So when you see the RFT, don't panic. Ask 3 questions yourself. That is the filtration is normal or abnormal? Like values of creatinine and GFR as normal or abnormal? Is there any waste accumulation like urea and then burn for blood urea nitrogen? Is there any balance disturbed in the electrolyte? So when you go to the history taking in the hospital, so don't think what if I am wrong. So just think what your mind is going to say. So a raised creatinine is just a number. It's not just a number. It is the kidney saying I am struggling. Low sodium is not just a value. It's the body telling you that fluid is balance is disturbed. So instead of fear, develop a curiosity. Curiosity builds confidence in you. So let's start the RFT. So what is the use of knowing RFT? So by taking RFT reports, we can assess the kidney function. Is there any fluid electrolyte imbalance? Is there? Is the acid base status can be no. There it is also helpful for our diagnosis or monitoring of the renal disease like CKD or any AKI. So what are the CKD and AKI in next video we can see. So first thing we need to saw the serum creatinine level. So what is serum is first actually is serum is the fluid which is present in our blood. So blood in the serum we can plasma minus clotting factor, we can see the remaining fluid is serum. So we are seeing the creatinine in the serum. What is actually creatine? How the creatinine is made? So waste material created in the body, it is during the muscle metabolism or any exercise, the kidney is filter it and throughout this waste through urine. So patient with a kidney disease, they can't throw out this material out of their body. This results in high level of creatinine in the blood. So the more level of the creatinine in the blood is going to cause any something more dangerous to the kidney. So let's learn the normal values of serum creatinine level. In the male especially, it is the value of 0.7 to 1.3 mg per dl is the normal value in the male. In female it is 0.6 to 1.1 mg per dl. What is the clinical relevance of serum creatinine? So serum creatinine is the, as usual say, a waste product of muscle metabolism. It is especially filtered by kidney. So if the filtered kidney is not going to filter, there is no reabsorption can be done. So if the reabsorption is done, there will be increase in the creatinine level in the blood. So filtration is going to be compromised. It leads to the decrease in the GFR. So definitely it is going to any dysfunction in the renal mechanism. So if what if the renal serum creatinine is increased, what are the condition you can see? So in the acute kidney injury, we can see the increased level of creatinine, and chronic kidney disease also can be seen in rhabdomyolysis. So it is the rhabdomyolysis is the tear of any skeletal muscles. It is the release of protein called myoglobin into the bloodstream. So it is again when it is enter into the filtration level, that is in the kidney, it is definitely going to be heavy for the kidney. so it is load for the kidney. That's why it is going to increase the serum creatinine level. The intake of drugs called NSAIDs and ACE inhibitors, amino glycosides, some maybe dehydration can also cause serum creatinine increase level. Urinary tract obstructions can also cause. So what if decreased in, if the values are decreased, what are the cause? So in the muscle wasting, in elderly or cachexia condition, there will be decrease in pregnancy due to increase in the GFR. There will be decrease. So interpretation tip. So sudden increase in the serum creatinine level, you should think about acute kidney injuries, and a slow progressive increase. Repeatedly we taken the reports of RFT. So it is the slow progressive increase. We can see, if you can see, it is think about the CKD, chronic kidney disease. Remember one point, it is the very important point. Every doubling of creatinine level, it is there is a 50% fall in the GFR level. So let's move for the next points, that is the blood urea nitrogen. What is meant by blood urea nitrogen? It is the normal value for blood urea nitrogen is 7 to 20 mg per dl. Urea is a byproduct of a protein metabolism. It is produced mainly in the liver. It is excreted by the kidney. As a waste product, it is excreted through the kidney. It is easily influenced by the diet, GI bleeding and hydrations. So what if the burn increased? So in the pre-renal causes like dehydration, shock, any heart failures, high protein diet. So some of these are the causes going to increase the level of burn. So GI bleed due to any cause, there is increase in the protein. Catabolic states like burns, fevers can also going to cause the increase in the burn level. What if the decreasing of burn level? Burn means blood urea nitrogen. So in the liver failure, there is no formation of urea there. Urea is not formed, there is no next further mechanism will be not there. So in the malnutrition also can be decreased burn can also seen, overhydration can also seen. So what are the important points related to the burn? And it is the burn creatinine ratio. So what is meant by burn creatinine ratio? So burn creatinine ratio is the main measure which we are basically seen in the clinical level. So if the ratio is 20:1, there are some pre-renal causes like hypoperfusion, dehydration. What if the burn creatinine ratio is less than 10:1? It is the intrinsic cause like tubular damage or post-renal causes like liver disease or any malnutrition can be assumed. So let's learn the third point, that is eGFR. E means E stand for estimated GFR, glomerular filtration rate. eGFR is the best marker of the renal function. It is better than the creatinine alone because it is directly measure the what are the waste product filter from the blood in the kidney. It is measured by eGFR. So what is the uses is in the age, sex and race. So normal value of eGFR will be more than a 90 ml per minute. So in the CKD, there are so many 5 stages of CKD, chronic kidney disease. There will be a first stage, that is G1. In G1, there is a more than or equal to 90 is the value of eGFR. So what it indicates means it is the mild kidney damage in this condition. So kidney work as well as normal kidney working in a normal way, but mild damage to the kidney can be seen in the G1. In the G2, there will be normal value is 60 to 89. So in this condition, mild kidney damage will be seen. Kidneys still work well. In the G3 stage, that is 45 to 59 is the normal. It is mild to moderate kidney damage can be seen. Kidneys don't work as well as they should. So in the next one is G3. G3B, in the G3B is 30 to 44 is the normal value, that is moderate to severe damage can be seen. Kidneys don't work as well as they should. Then the next one is G4 stage, that is 15 to 29 is the normal value. In this condition, severe kidney damage can also seen, and kidneys are close to not working at all. It is not completely not kidneys are not working, but it is near to the not working. Then last stage is G5 stage. It is less than 15 will be then this value. Then the most severe kidney damage can be seen. It is ESRD, end stage renal disease. Kidneys are very close to not working or have been stopped working, or we can see in the simple language, that is failed. Kidney failed can be seen in the if the value is less than 15. What is the clinical tip? So eGFR, estimated GFR value decreases, but creatinine may be normal in elderly or low muscle mass patient. So what it indicates is, if the eGFR value is decreased but creatinine is normal in the condition called elderly or low muscle mass. So if the creatinine value is decreased, GFR, see here, if the increase of creatinine level is there going to be decrease of GFR, but in decrease of GFR, creatinine may be normal in elderly or low muscle mass. So last point is serum uric acid. So normal value is 3.5 to 7.2 mg per dl. It is if the value of uric acid is increased, it going to cause the gout arthritis can also seen. It is also seen tumor lysis syndrome, CKD, diuretics, taking in diuretics and alcohol can also cause the increase in uric acids. Decrease in uric acid seen in the SIADH, matlab syndrome of inappropriate ADH. Wilson disease can also give an example, Fanconi syndrome. So last part is serum electrolyte level, that is potassium level. The value of potassium normal will be 3.5 to 5 milli equivalent per liter. So if increase in the potassium level in the CKD or acute kidney injury. In sodium, normal value is 135 to 145 ME per liter. So it is sodium is decreased in SIADH, over hydration or CKD condition. Increase in the dehydration is sodium. So bicarbonate can normal value is 22 to 26. The decrease in the bicarbonate seen in metabolic acidosis. So today, don't just memorize the values, learn to think, connect and interpret, because one day a patient life may be depend on how confidently you read this simple RFT. Thank you for watching. For these type of clinical videos, subscribe to my channel and follow our Instagram account RFT-Renal. Thank you.